Hello, everybody.
Hi.
Welcome, welcome. Okay,
Did
let's go
they-
ahead and start the chat. Let us know where you guys are coming from. Where are you watching from? Love to see where you are. Want to welcome Jennifer.
Hi. Welcome,
Hello, hello.
everyone.
I'm going to click that chat box. I want to see where everybody's at. Illinois.
Vermont.
People are trickling in.
Back there. Thank you for staying awake for this.
I know. Thanks, guys. Tucson, Rebecca Deneen.
Hey,
Hi.
Becky.
Thank you guys so much for being here. I'm Elaine Rodriguez. I'm the founder of Dental Laser Integrations. This is our study club format where I highlight amazing speakers who are utilizing technology and science and clinical hygiene and applications to do amazing things. And tonight I am hosting Jennifer Vermillier of Edge Wellness. She has a ton of experience to share, so I'm going to be going over her intro in just a second. But first, I want to just highlight some housekeeping items. Everything is through Zoom. So make sure that whatever email you received from the Zoom platform when you registered to sign on to this webinar, you look out for that same thank you email from Zoom because that is going to be where your CE credit for tonight's program is going to go. Okay. And of course, you guys can reach out to me with any questions, but just please plan to look for that. That is going out in 24 hours. So about this time tonight, you should be getting that in your inbox. Okay. So please be checking spam. Um, please check your inbox and what have you. So, Jennifer, I am so excited to host Jennifer because
We've been talking about this for a long time, and I'm really excited to share this with everyone tonight, because it's amazing what you can do with your hygiene license.
years. I've been trying to host this for years to really highlight Jennifer. A lot of people say they're the laser queen out there, but very few have the credentials that Jennifer does to say that. And so why not learn photobiomodulation from a hygienist who is actually using it? So Jennifer, please tell us about your authority, your background, how long have you been in dental?
Well, actually, I've been a hygienist for 48 years. I know it says perio hygienist with 30 years experience, but I actually have been doing this 48 years. And on my 50th, I'm holding out. I'm still 1 day a week hygiene, and I'm holding out for 50 years because I want a big party. And I think I deserve a gold tooth.
Can I see you guys give like some clap marks in the chat for that? Like, there are so many hygienists burning out after 1, 2, 3 years with very good reason. And believe me, we're going to be hosting some webinars on longevity and wellness and how to really kind of invigorate our clinical practice. But that's not the topic of tonight. So,
No,
thank you. Yeah.
I think the reason I mean, I got into lasers a long, long time ago, about the same time Elaine did, actually, about 15 years ago. I've been using dental lasers, and we met at a conference, a BioLase conference, and from there, our relationship grew to Elaine got her teaching certificate, and then I joined her in teaching laser certification all over the country until COVID hit, and then we went back to doing more less online stuff, but we still teach some live courses in
Mhm.
Phoenix and Tucson, and you still go travel. I don't do that anymore, but
No,
I
I
do.
can't get you on a plane.
Yeah, I'm no, I don't want to do that anymore.
Hello.
I
Yeah,
really
I
like
don't blame
doing
you.
what I'm doing because I went from being a laser hygienist to um, being a full body laser specialist when I gave a presentation with the A, what was it, the AD, the A, mm, ah, the
The
Academy of
AA Sensei.
Dentistry. And Thor was there, Nova Thor, and they had their laser there, and I had a partial tear and a rotator cuff. And so, in the 4 days that I was there, they healed it. And so my boss was with me, he bought it, and we used it for TMJ treatments, and it worked so well. It's absolutely amazing for TMJ. 6 sessions and they are well. Um,
So, Jennifer, so years and years ago, you're working as a private practice clinician. You attend Academy of Laser Dentistry with your boss. Okay, let's go back to that. This is shortly around the time that we are talking, because I met you before you guys got
Mhm.
the Thor bed, and we were still just having you do your opioids.
Oh
Okay, so
yeah,
that was really like the first program that you presented for Dental Laser Integration Study Club.
right. I do
Okay.
an opiate addiction seminar as well. I give various laser seminars.
Okay.
Apples to apples, I do that one, but we did start, the big one was the opiate addiction seminar.
Okay. So now you went from utilizing Waterlay's laser, BioLays, Epic Laser, doing
Mhm.
TMJ, whitening, perio, doing all the things with your diode laser, right?
Correct.
And then here you are moving on to using this. So tell me about how you got started
Well,
using this.
when we purchased this laser at the ALD convention, we had to take a course on it. This laser is about a $36,000 laser now. It comes with 5 hand pieces, and I can show them all to you later. Um, but you have to take a course in order to operate it, and you have to have a medical director. So the dentist is the medical director. At
Hmm.
Edge Integrative Wellness, Maria, Dr. Crawford is my medical director. So
Okay.
those things in force, you need your hygiene license, you need to be a certified laser, you need to be certified in lasers, the diode lasers, just like you are. I went on and got my intermediate and advanced, and I took 3 Thor courses in order to operate this under Maria. And um, that's how I went about it. And so I've been doing these types of treatments with the Thor LX 2.3 for 8 years, and with
Okay.
a laser bed as well.
So, Jennifer, so you are still at Dr. Fuller's practice, private practice in Tucson. You guys now have this Thor bed that you guys are putting patients in, and now you're starting to use this.
Mhm.
Talk to me a little bit about what were you doing with it early on? How were you guys implementing it for just localized dental applications?
Oh, early on, we were just using it for trigeminal neuralgia, TMJ. Um, when we opened Laser Wellness, we started treating full body, concussions, slight meniscus tears, sprains, strains, tendinopathies. It is photomedicine, is what photobiomodulation is photomedicine. And it is absolutely the best non-invasive way to therapy to regenerate tissue. And that's what we do, and that's what I do now as well. Um, but the light penetrates. It's the photobiomodulation basically is specific wavelengths of light. So you've got the 660 light and you've got the 800, the near infrared and the red light. Those two lights together um, make photobiomodulation. So what it does is it enters the mitochondria of the cell. The light penetrates and is absorbed by the mitochondria. And this shows a little bit of a cell here. And we all know the mitochondria is the battery of our cells. So what that does is that light energizes that mitochondria to produce ATP or adenotriphosphate. And that is what helps your tissues heal.
Mm-hmm. Mm-hmm.
It increases circulation to the area of the body. And when it increases circulation, it decreases inflammation. Inflammation is what's causing the pain to the patient. So therefore, it delivers this energy to help reduce pain. And that allows your tissues, your body to naturally heal itself.
Beautiful. And thank you for that. And it's so important as clinicians who are utilizing laser technology to really understand the cellular science. And obviously, tonight, I wanted to focus on the healing aspect. But as we move through our three-part series, this is part one. I will be sending you guys invites to part two and three if you're not already registered. But we're going to allow you guys to kind of or guide you guys through a more deeper understanding of the cellular science because truly that is what sets you as the clinician, you watching as the authority figure because your patients, you don't want them to know more than you do. You want to be able to educate them in a way that they understand your clinical knowledge, your expertise, your knowledge of the science. And like Jennifer said, you need to understand inflammation. So between Jennifer and I and Dr. Desai, that's going to also be educating with us. That's the purpose of this class. And so the name of this program is Hygienists as Healers, because that's exactly what you are. And I'm going to play a cute little video for you guys. Just let me show you guys this.
That's our Novathor pod or laser bed, and it's a 12-minute systemic treatment.
This is so cute.
Usually you're
Cute.
in it also naked. You're not in it with your clothes on because the light has to penetrate your skin. So,
So
anyway,
Jennifer, I have a question for you. So
mhm,
this is where I'm excited for you to share with us, okay? Because we I'm fortunate that you share, information with me about your patients and your cases and some of it you cannot, share and tell, of course.
right.
But talk to me how your intuition, your knowledge of the body, you starting to treat more and more patients. Tell me how you started becoming more, um, just more aware of the pain centers of the body, how you could help patients, because now you're not just the clinical hygienist, you have parlayed yourself into Edge Wellness, which is an integrative
Correct.
medical center that's focused on pain management, pain therapy. So I want you to talk about what is Edge Wellness and what is your role there. And then I'd like you to share some cases about how you're treating some people in your
Well,
practice.
I work with an amazing group of women, nurse practitioners and doctors, Dr. Maria Crawford, Dr. Andrea Piazzato, and nurse practitioners that do IVs and peptides. And I have, over the 5 years I've been here, I have learned so much about medicine from them. But also with my patients that come in, you tend to see similarities in their injuries.
Mhm.
And like many times somebody will come in and they're sure they tore their rotator cuff. When I see a patient with something that might be torn, I want them to get an MRI because an MRI is going to come over. Maria's going to be able to read it and tell me exactly where I need to treat in the area. So
Mhm.
I always like to have more like x-rays and MRIs to go from to help them because so many times a shoulder, it's not a tear in the rotator cuff. It's actually C3, C4 in the neck that is pinching a nerve that's giving them pain that goes into the arm, runs down. And if it goes to the elbow and is giving them tingling in their fingers, then I'm more suspicious that I need to start treating C3, C4. But I want to
Mhm.
confirm that with an MRI. Um, At Edge, we believe in trying to find the root cause of a patient's illness or pain, and we have many modalities to pull from here. Not only do we use red light therapy, which I do, I also do soft wave therapy, which
Mhm.
is like it's a pulsed radioactive. It's like electric shock. It does, the patient does feel it, but it works very well at bringing stem cells to the area to help. It actually puts the red light on steroids. So the two of them
Mhm.
used together are really good for lumbar areas and the back and slight meniscus tears. And we also use peptides. In a functional medicine office, we can get a patient peptides.
Mhm.
They're not FDA approved yet, but they're going to be, and especially one that we use predominantly, the Wolverine peptide, is
Mhm.
um, is going to be FDA approved very soon.
One
Um,
of the treatments I've received there was the methylene blue
oh yes,
IV, and
we do
then
methylene blue IVs and we do ozone IVs, we do hydration IVs, immunology IVs to boost your immune system. We do all kinds of IVs. We have two special nurses that just do IVs.
so
Um,
Jen, when somebody goes into the clinic, and let's say like me, the day that I went in and had a methylene blue
mhm.
treatment, what would have been the benefit of me going in the red light bed after that?
Oh, okay. That is, biohackers are promoting, highly promoting giving the patient a methylene blue IV and then putting them in the red light bed or having them have the IV in while they're in the red light bed. It's just easier to give you the IV and then put you in the bed. What it does is the red light activates the methylene blue to help destroy viruses, clean your toxins from your body, and it works very well. And they're doing a lot of research right now with the red light bed and methylene blue.
Mm-hmm. Okay, very nice.
We
And
also do PRP injections, which is protein-rich plasma, which would take your blood out, spin the plasma out, and give you the injection. So if I have a patient that's not healing like I'd like them to in like the fourth session of a laser treatment, usually my protocols are 6 to 12 treatments. So by 4 treatments, if they're not getting substantially better, then I will talk with Maria about, hey, do you think we should use peptides on this patient? Do you think they should have a prolozone injection, which is a ocean peptide, and it
mhm.
has vitamin a B12 in it and some other things. And we'll either use that or we'll do a PRP injection. So we have so many modalities open in at Edge Integrative Wellness that it's so much fun to work here.
So thank you for sharing that. And so we're going to talk about a few different cases that you treat.
Mhm.
Um, so please tell me a little bit about what you're doing with wrists. So Becky came in and you were treating her wrists, and I had got some photos. And uh,
Mhm.
so tell me
And
what.
Becky is on this webinar as well. She's
Yeah.
a very good friend of mine and hygienist that we work together. And Becky took a spill on her mountain bike. She's quite adventurous, a little too adventurous sometimes at night by herself. But anyway, she fell, broke her wrist. She had to have surgery. And we just helped her heal faster. And she was able to get back to work a lot sooner than the doctors anticipated and get more mobility and it just helped her heal faster.
So why is that though? The photobiomodulation did what, and how was it that you knew that it was going to help her?
Um, because it does. Um, well, a lot of photobiomodulation now in the past, now Becky's treatment was done, I don't know, about 4 or 5 years ago, I think, or maybe even 6. Before that, now it is really being predominantly used for post-surgical care on patients. More and more doctors are using it. Even your PTs are getting involved with red light therapy and seeing how their patients heal faster because you are that ATP that you're producing is making new cells, healthy cells that take over the diseased or dead cells or the cells that are making you inflamed and hurt. So it activates this in your body and it heals you faster. Like
Hmm.
wounds, it's amazing. I had a lady come in 3 days ago, totally wrecked up. All five of her toes were just like road rash. And today she came in and three of them are already healed. It's amazing. This is Dupuytren's contracture here. I'm trying to develop a protocol for Thor um, on Dupuytren's. I've been seeing quite a few cases and getting really good results with using the
Okay.
laser on softening the tendons, um, just reducing
Jennifer,
the inflammation. Yes.
sorry to interrupt you. What is Dupuytren's before we go any
Oh,
further, and
Dupuytren.
what are the symptoms of that patient?
Okay, Dupuytren's contracture
Mhm.
is a tendon disease, or it's congenital. It usually comes from the northern England, the Isles around the northern England. So if you have any kind of DNA from there, you can develop it, and it pulls. It's kind of, a lot of people call it trigger finger, but
Mhm.
it can be where these cords in the hand just tighten and you can see them. And they typically cannot flatten their hand down. Now, this patient,
Yeah, they have
we
really
have
like.
gotten to where we're getting there, but she couldn't put her hand down at all flat. And
Mhm.
now she's able to do that.
Okay, that is so neat. And um, I wasn't sure that we had permission to show any of like the Thor pages and protocols, but how did you know like where to put the laser and how, how that was going to work and how much treatment time and how many applications? Because like here, you're doing something to,
I think I'm treating
um,
a TMJ.
okay.
That's
So talk to me
again,
about
she's a
this
problem
one
child.
still. Like,
What we do is, well, this one, there isn't one, a protocol, but Thor is really good about letting me make them up. I have one that I did for them on erectile dysfunction. And of course, I don't have any pictures of that. Sorry, not too many people want to share. Let me take photos of those kinds of things. But
I have this little nifty picture of a penis just to give you guys an idea.
right. So what is, what is erectile dysfunction? If it's not caused by medication, by a beta blocker, then I can sometimes help them because it's about increasing circulation to the area to
Mhm.
get more blood flow. And more blood flow is what they need to have an erection. So oftentimes just applying the light, and a lot of times too, I do use the TRT or soft wave machine as well with it because they work well in conjunction to handle this problem. And it's just if there's an inflammation of the prostate, we have the intraoral probes fit very nicely into the anus and can hit the prostate. Remember, this light shines 2.5 inches deep into an area. So you
Mhm.
really have to be up on your anatomy. And I have always kept up on my anatomy physiology. And I work very hard at keeping track of and learning what parts I'm working on a patient, what I'm working with to help them. And
Yes.
Thor has a library of like 40,000 protocols. So I can go to lower back strain in their library and pull up the protocol, and it will tell me where to place. This is the 660 light. This increases circulation to an area. It's safe to put over the eyes. I have used it on macular degeneration, and it is helping a patient. I've been treating her for 5 years now. Here she is. She's thrilled. She comes in once a week. We do a once weekly treatment. Her ophthalmologist is very happy with her progress because she's not progressively getting worse. She's staying the same or getting a little better in some tests. So this is the light that's safe to put over your eye because it's a 660 wavelength.
So how is this person affected by the macular degeneration? Like what does that do and why what is it about that condition that makes red light or photobiomodulation effective for that?
Well, it's an inflammatory condition. So what does this probe do? The 660 light reduces inflammation, increases circulation to the area to reduce an inflammatory situation. So macular degeneration, dry, is an inflammatory. It's basically our body is always in an inflammatory state in some way, shape, or form. Um, I think that's why the bed works so well systemically on fibromyalgia patients because it gives them an overall systemic treatment of the two lights combined that helps increase ATP in every cell in their body. These only increase where I'm putting it.
Hmm.
So and this one is for pain management and tissue repair and nerve repair. So Thor tells me on their protocol for a shoulder, say, for rotator cuff, where to use each one of these for how long and at what frequency. So I just set my machine and I use it the way their protocol tells me.
Hmm. And so going back to your some protocols you have and some you don't, and you've really starting to pioneer treatment in like the reproductive area. So there's, and you must have treated this a long time ago. This is just like a Google image that I pulled. Um,
I do a lot of like breast augmentation, post-surgical wounds, their scars, because it helps. First of all, it reduces inflammation, so they heal faster. They're not as sore as long, and the scarring disappears. I mean, it really helps the scar tissue disappear.
Interesting. And so, kind of circling back to the reproductive region, you're now working on a condition
Lichen sclerosis is about the only one that
like in
I've had
sclerosis.
several patients with. Well, they call it the doctor will their gynecologist will say it's lichen sclerosis. Sometimes it can be a lot of times what we found is like Maria then comes in and takes over. And if it I usually get the redness to reduce and the
Hmm.
pain, but it won't maybe all the way go away. So then we
Hmm.
know, okay, maybe it's a gut issue. So we do testing. Um, we'll do stool testing and we do gut testing and blood testing and see if there's something in there. Maybe they're allergic to gluten or maybe they're um, whatever. That's her end. She does that. And then I just work on helping the patient be more comfortable there with the red light. And usually it's just this probe right here. This probe right here does it all. This is what heals wounds. I've healed diabetic wounds to where people didn't lose their toes or their feet just with
Hmm.
this probe alone. Red
Hmm.
lights.
So you going back to the symptom and the clinical presentation of it, it's a lot of, is this an immune response, is this an inflammatory response, is this a secondary effect of something you're eating, some sort of dietary, so you're not just, so as you're in this integrative practice, you're
Right.
not just looking at the localized region, and that
No.
would be the equivalent of us seeing red irritated inflammation in the oral mucosa
Just
and
like
just
we do
saying to
there.
floss more, so there's more to the story, right?
Right. And a
So,
lot of times I'm seeing a lot of women too, like we're the two doctors here are hormone specialists. Okay.
mhm,
So we see a lot of patients that we treat them hormonally. So we do hormone pellets. We guide them to what their body needs. And a lot of times we have patients in who are postmenopausal, they've never been on a hormone, so they're now they're 50, 60 years old. They still want to be sexually active, but they're dry and it's painful. And so the red light does help soothe that. But what's really missing is getting, like we like to get to the root cause here at Edge. And they need to be on a hormone, estrogen. We all need it.
I'm going to take a pause for a second. I'm going to check the chat box. How are you guys enjoying this so far? Um, Ladies and gentlemen, I want to check in with the chat because Jennifer is now just kind of sharing some different ways and some different conditions. I mean, what a far, what a far stretch from treating oral gingivitis to,
Not really.
vaginal mucosal inflammation, right?
It's all the same. Inflammation is inflammation. I mean,
Yeah.
you guys are hygienists. You see the worst of the worst is in the mouth. Trust me. If you have a hygiene license and you're laser certified and you want to go outside the box like I have, it's there. It's
We're gonna pick your brain in a little while and talk to you about like um what kind of like hard and soft skills did it take for you to kind of move forward and out? Um and then I promise guys I'll look a little closer and back at the chat to see what your comments are. So thank you guys so much for listening
And
and
also, too,
being
you're going to
here.
be able to reach out at the end. I'm going to give you Edge Integrative Wellness's website and my or our emails, so you can reach out to me and to Elaine and ask questions. There was a question that just kind of hit me here: is can
Mhm.
peptides be used in dentistry? And that would be probably right now no, because dentists are ruled by the FDA and they're not FDA approved. Would they be able to be helpful? Methylene blue can be helpful, but the doctor has to be able to prescribe it.
There, in part two, we're going to be highlighting Dr. Raul Desai. He's a medical practitioner and radiologist who is focused on using PRP, PRF, peptides, red light therapy. So he did say that he was going to educate us on some oral applications and what is available. So,
And I will answer another question here. I have used the Thor laser on the gingiva because I have the oral, here they are. I have the 810 and the 660 oral probes. So I can go in and treat oral mucositis with this. And here's a case right now I'm doing on a lady who had cancer of the tongue and had a piece removed, and the radiation gave her xerostoma, and I have brought back her saliva flow for her. She's very grateful. And it's just I used these two probes and I used this one just inside. You can get this one inside the mouth, but mainly I use these two.
so
Or does
being
have a
able
lollipop, but I just don't have it. But it's a lollipop. It looks like a popsicle and it goes in the mouth. It's for oral mucositis for cancer patients. It's a 1 minute treatment. I did have it at Laser Wellness, but I haven't been able to afford to purchase it because it's expensive.
talk to us about this one, Jen. Is it the same case?
Yes, and I'm using this to go along her lymph glands to kind of drain her lymph nodes here with this. And also, she lost bone on her mandible from the radiation. So I'm using this and the 810 along the mandible to help. What do our diode lasers do? The 810, it has osteoblastic activity, so it can build bone. It can help her build bone back. So
Mhm.
that's what we're trying there.
So neat. So neat. So other things just kind of mentioned TMJ.
Oh, the Thor laser is a game changer for TMJ. If anybody has TMJ patients, please send them to me. I have yet to have a case in the 8 years that I've been using this laser that came back to me and said, their TMJ is back. Now, I do strongly recommend they go to their dentist after the fourth or fifth treatment with me to have an occlusal guard made, because most of the time it is occlusally related. They're either clenching or whatever. But when you combine your dental knowledge with laser knowledge, it's it's fun. It's
And
just
so it's really important for us to kind of understand the symptoms and the debilitation of that patient because we've all come across someone with TMD. There's various grades of it, right? So how bad does it have to be for them to come see you?
I would say at initial stages start. I
Hmm.
mean, the dentist that I work with, also oral surgeon and orthodontist, have sent me cases right from the get-go when we.
Well, not just any orthodontist, right? People who are very well versed in photo medicine
Right.
and are believers.
Yeah. So it's TMJ. I've had very good success with trigeminal neuralgia also. That's a very tricky one.
Mhm.
Um, but I've had very good success rate with TMJ.
So, can you talk to me when you're treating somebody for TMJ or TMD? What are the treatment goals? Because it's a musculoskeletal condition where often they're bone on bone and they're getting lockjaw and they're, getting secondary and referred pain, headaches, neck tension. So, what are the treatment goals for that patient?
Depending on the patient, again, if they're getting headaches, I will go in and use the traumatic brain injury or concussion protocol along on their head, on the frontal lobe, and where they're getting pain in the back, um, in the occipital lobes. I'll go all over
Hmm.
it because wherever they're having pain, I'm going to treat. And
Hmm.
but specifically, the intraoral probes, you go in and you'll hit the pterygoids with that, and that softens them. It's amazing how that light relaxes those muscles so quickly. And a
Yeah.
lot of it is just relaxing the muscles of mastication, um, your masseter muscle, your temporalis, your pterygoids. You go in and you laser them, and after 6 treatments, it's amazing how much better they get.
Yeah. And you had already been doing this at Dr. Fuller's in private
Right.
practice, right?
Correct.
So you had been doing that with the Epic, the Biolates Epic.
Well,
Um,
we did that. We had the Epic, but remember, we had this back in 2017. We had the
mhm,
LX2 after I
mhm.
gave that lecture at the ALD. He bought it and we started treating then with this. But prior to that, yes, we were using the Epic. And I got really good results with the Epic. It's just this
Mhm.
one's
More
it's
powerful.
just much more powerful. It's a great
Yes.
3D laser and it's much more powerful.
And so
And I
in
do
our
treat migraines, somebody asked in there, and I have not
migraines and
had
Meniere's is the
Meniere's, but
question.
I do am going to start treating with the intraoral probe tinnitus with it too, and they do have a tinnitus protocol, and I think it follows in line with Meniere's, but I have not had a Meniere's case yet. So being honest, no, I have not treated it. Is it treatable? Probably.
I'm getting a question about some oral lesions, some
Yeah.
aphthous
Mhm.
ulcers.
Yes, I
Can
have
you talk to
treated.
us about that a little
Yes.
bit, Jen?
I have treated, do you not have oh, I think I have those for the third presentation. We'll
Okay.
be going over the kid that I had 80 lesions in his mouth, and I used the Thor laser with it and the intraoral probes and the my other ones, the clusters on it. But yes, you can treat with the Thor laser, and I do treat herpetic gingivostomatitis. I have treated many cases of herpetic gingivostomatitis in kids and
Can you
adults. I have an adult with it right now too.
And how important is it, Jen, for us to kind of be able to recognize these pathologies and remember the anatomy of the head and neck and how these things all innervate and come together and present as pain, inflammation, dysfunction?
Um, I as a hygienist,
Yeah, as a hygienist,
well,
as a
as a
hygiene
hygienist,
healer.
when I'm seeing a patient and asking them, do they have any discomfort or any pain in the TMJ? And I always check their TMJ. We're always looking for, oral pathology.
Mhm.
I hope we are. As you know, we have to do so many things now all at once in that 45-minute to an hour period.
Yeah.
So I do feel your pain there. But I just give them my card and say, if you want, come see me and see if I can help you.
Hmm.
And I'm telling you, as hygienists, if you have patients with any of these things, let them know that there are laser treatments, red light therapy that can help them. Um, and I would love to, I love to heal. I love to heal patients. So
And so the reason why I'm kind of like prompting you to like kind of give us that background and that feedback is because I see, all kinds of practitioners, from all backgrounds and walks of life and have been doing this for, various years. And depending on who we're working for, who we're working with, what technology we have available, some of these things we
yes.
start to lose, like kind of use it or lose it.
Hmm.
And so when we're teaching laser courses and we start to talk about these treatments, so in our level one laser course, we talk about TMJ, we talk about oral lesions, gingivitis, and it's very obvious to me that people have not utilized that particular set of knowledge and skills and verbiage in a while, and oftentimes if you're not getting oral pathology training or even going back and reviewing your perio nomenclature, you're kind of behind. And so in Arizona, I'd love to see who's here from Arizona. If you guys want to put in the chat, Arizona hygienist, um, we can do Botox now. And the reason why we as dental hygienists are the ideal practitioner to provide Botox and fillers, and of course, I know I'm not using the proper term for it, but neuromodulators, is because of our extensive knowledge of the head and neck. Nurses have to go back and get secondary training, and that's how they grade one another on whether or not, one's a good injector over the other is their knowledge and acumen of the head and neck. And now here's Jennifer, who has kept abreast of all of that cranial nerves, cranial muscles, um, knowledge of
Well, you see all
immunology,
my
right?
charts. You see all my charts around my room. I have one for the skeletal system, one for the muscular system, one for the nervous system, and one for the circulatory system. And I do a lot of research and I do work on my own to make
Mhm.
myself more knowledgeable so that I can help my patients better. And like
Yeah.
I said, I work with an extremely amazing team of women. Um, I can't say enough about the two doctors, the nurses, our MAs, our front office people. Everyone is just wonderful to work with. And we strive very hard to treat our patients as a patient and listen. And that's what I think is the most important is if your doctor hears you, they can help you.
And thank you, Jennifer. And we're kind of on the downslide of tonight's program. So I would love to get any more questions or
I
key
have one more probe I
takeaways.
want to
And
share with you.
please,
So
please.
this is the acupuncture probe. So this helps me detect where inflammation is in the body on a patient. So if I have a patient come in and they don't have an MRI and they just are saying, "Oh, my elbow hurts," I can use this probe here. It gives a direct 810 beam into a focused area and it registers the inflammation on my machine. So if it's over 500, I know that there's inflammation there. So if I have a patient and I hit a spot and it goes to 1500, it's a myofascial point that I've gotten into that has inflammation. So I direct that beam of light directly there and that will help relieve the pain. So it's
Mhm.
kind of like I call it acupuncture, but it's a myofascial inflammation finder. And this is one of my most important ones because it tells me where to place those other two uh, clusters if I don't
Mhm.
have a protocol to follow.
That's really neat that it is giving you a reading on inflammation.
Mhm. Oh, the patients love it. They'll go, "What's my inflammation today?" And then they see when they come back the next time, oh, it's lower. They pay attention. They want to know what their
Yeah.
number is. And
Yes.
if I'm, what is it? What is it? So,
And
yeah.
isn't that the same as a laser dental hygienist when you're working with the patients and you have got them into a scaling and root planing,
Mhm.
periodontal program, and you're doing the red light therapy on them, the laser bacterial
Right.
reduction,
Uh-huh.
you're of course doing some scaling, but also walking them through understanding what their numbers are, what inflammation is, where it
Right.
comes from, and then seeing them back for there's multiple visits thereafter and they're excited for it, right? So
Mhm.
talk to us a little bit about that.
Well, I mean, it's like I said, I don't do that much hygiene anymore, but I do 1 day a week. And they are, I always talk to my patients about their periodontal numbers, their pocket depths and their bleeding. And I've turned so many patients on to using the laser, even if they don't have pockets, but they have bleeding. Then
Yeah,
that means there's inflammation. And they will
exactly.
come back and be really excited because they didn't bleed for the whole
Yes.
time in between cleanings. I had a man come in the other day. He goes, I don't know why. I've never heard. You were the first person who ever told me about a laser. And I know it was hard for you to talk me into using it, but I'm so happy I used it last time because you were right. My gums don't hurt. They're pink, they're healthy, and they don't bleed. And he goes, I
Yeah.
will never have my teeth cleaned again unless I can have a laser. So
Yeah.
I made a believer out of him, and I
Yeah.
do most of my patients. But I had a
I get that
question.
too.
There's a question here about working at Edge. Are you still being supervised by a dentist? No, Maria is my medical director. A dentist, a doctor, let me see, let me get this all right. A chiropractor, nurse practitioners can all be your medical director. So if you go into red light therapy, your license gives you the ability to use a laser. This is a diode laser. It's a grade 3B laser. Your dental lasers are class 4 lasers because they cut. This one cannot cut. It cannot burn. It cannot cut. It is not like it can only be used on, for tissue, soft tissue.
Mhm.
And so you can't do surgery with it like you can your dental lasers. So no, but a dentist can oversee you using your lasers at your dental practice, and a doctor or a nurse practitioner, chiropractor, acupuncturist, I think is the other one that can oversee you as a medical director.
So who is Maria and how did you come to work in that practice?
Wow, let's see. Maria found me she came to me at Laser Wellness of Tucson from another patient who was a patient of hers. And that's how I got connected with Maria. And so when Dr. Fuller moved the practice to Scottsdale, I bought one of the lasers and I came to work at Edge 5 years ago.
Okay. And so I was so um
No, I'm not doing dentistry. I do not do dentistry at Edge. Somebody asked if I do dentistry at Edge. No. Do I treat oral mucositis or certain things in the mouth with the Thor laser? Yes, I do. But I don't have dental instruments. I don't do dentistry, and I don't have a class 4 laser here.
Mhm. And so I can't stress enough how Jennifer did her time in dental and
Yes.
you partially don't let it go because they won't let you. Like
No, they
and
won't let me retire. They won't.
and that being said, I think it's absolutely amazing that you have been able to transition yourself.
Mhm.
And so what do you think were the skills that helped you in that bridge, Jennifer?
I think I always was very, very interested in becoming a doctor. I was always interested in medicine. I loved pharmacology. I'm a walking PDA, so that really helps me in my practice here. Um, and I loved anatomy physiology, and I just kept abreast of it. And when we started, and I've taken three core Thor courses, so you get to each Thor course you take, you learn more and more and more about
Yeah.
the body and cellular development and how the red light is absorbed by the tissues. And I can't say enough about how thorough they are in their training.
So I took multiple fellowships. I've taken some of Thor's advanced courses too, and they're very focused on the science. And I've had many people work with me. I've worked with people in clinical practice. I've had people who wanted to be, clinical trainers with us. And if you're not apt to the science, if you can't pronounce the word,
Right.
I it should be a standard. We talk about working to a standard of excellence. Um, the person who has created the Thor laser,
Mhm.
they are they are very, very succinct when it comes to the science and research and development.
To them,
And
it
they
is photomedicine. I mean, he is a physicist and he is brilliant and they do their double blind, all of their protocols are double blind tested through Harvard Medical Institute. His wife is the doctor. I contact her all the time. I email her, Karen, all the time with questions, and all the people at Thor. They're very, very good at getting back to me and helping me and wanting to know what I'm doing um, as a clinician. So it's fun. And
Mhm.
how you get to do what I do is you have to take the courses, you have to purchase the laser, and you have to have a medical director. So I just happened to have fallen into with a dental practice that bought this laser, and we used it on our patients for head and neck things. And then we opened up Laser Wellness of Tucson and bought the bed, and we started treating full bodies. And then, like I said, he went his way, I went my way with Maria. So you have to, the best thing somebody asked, what do I have to do this? Well, you have to be laser certified. You have to have your license. You have to keep your dental hygiene license. You have to have a medical director and you have to have the laser and you have to take the Thor classes.
I'll add to that. Okay. So those are like the hard skills. That's the red
Hmm.
tape. You got
Hmm.
to have
That's
the
the red tape.
equipment, you got to have the credentials.
But you
Um,
also have to be very intuitive and very in tune to the medical, the body, the human body.
And I have some other speakers that I'm going to be highlighting later in the year: naturopathic doctors, myofunctional therapists, craniosacral massage therapists, people who are very, very in tune with the regulation or dysregulation of the body. So I am on a mission now. I'm fired up again to start having these webinars and connecting with us, our community, and helping us kind of create bridges to doing more because we're so capable of doing more. We have this. And so I'll add to something that Jennifer said. Again, the reason why I'm so proud to work with Jennifer, so proud to highlight her in this, I feel like I haven't even done you justice tonight, Jen, is because you were an authority. Before you were an authority in laser, you were authority in that office. We talked endlessly about your team culture, your leadership, how you have advocated for commission schedules, higher wages, better instruments, medical insurance
Oh, yeah.
for
My
your
one bad
team.
apple spoils a barrel. My
Okay.
manuscript, one bad apple spoils a barrel. Yeah, I do. That one is a good one too.
And
Um,
then as you started to kind of grow in your knowledge of the body, you spoke so beautifully, in the opioid class about how a key takeaway was how kids, who end up growing up and to be adults or young adults with addiction, their first
Tasting an
exposure to
opioid is
opioids
in the
was,
dental office.
yeah.
Their wisdom teeth. Right. So many doctors now, like our oral surgeons, they rarely use, I mean, especially on wisdom teeth. They'll hit them with the laser because we have the BioLase laser at where I work. And they're getting away from using opiates, which is great. One of the questions is if you lived in another state
Mhm.
and you wanted to find red light therapy, you can go on the Novothor website. So it's Novo, Novothor, Novothor laser website. You can hit the button locations and it'll give you all the locations of where they have the LX2 or where they have the bed. So if you live in another state and you want to find treatment with a Thor laser, and I think it's the best one. It's world renowned. All the sports teams have them. Um, NBA, NFL, MLB, the Olympic quarters has Thor lasers. So they are widely used worldwide. So it's an excellent laser. And softening scars, yes, they can soften keloid tissue.
I
Would
thought
you
I had a
like
photo
can
of
you
you
just
treating
can you can you let
my
me just give
sister.
them Edge's website so they can look into if they wanted to other treatment modalities like
Yeah,
IVs?
I'd
Um,
like, can you type it in or would you like me to?
I can't. Let's see. Maybe I can't. Oh yeah.
What is it? Give it
Oh
to me,
yeah.
Jen, and I'll type it.
It's hello at edgeintegrativewellness.com. I can type it in.
I got it, Jen.
Did you get it?
And
Okay.
then if you want to tell
And
me the
then
Thor website again.
it's Novathor. You just go on, just Google Novathor lasers and it pops up and you go to locations. But if you want to
Okay.
give them my email address to ask me
Yes.
questions,
Mm-hmm.
it's toothwitch. No,
Toothwitch32 at Comcast.
yes, at comcast.net. No,
But you're not a witch
no, but I couldn't
because
get
it's not
toothbred.
magic.
It was already taken. So yeah. And would be happy to answer any other questions that maybe I'd missed on because I was talking and I didn't see all the scrolling of the questions. But I don't if I don't know what else to say other than, 48 years of dental hygiene and I really love being a hygienist, but my thumb joints and my neck were breaking down and the only thing that has saved me is red light therapy and now peptides. I'm a big believer in Wolverine peptides. So, um, but the laser works very well for helping us with our mucoskeletal pain.
And so thank you, Jennifer. And so again, this course was really meant to encourage and inspire you guys to see your capabilities as healers because that's
Yep.
exactly what we're doing with lasers and periodontal therapy. You are healing a chronic degenerative condition that otherwise will continue to worsen, persist, if we don't do more. And that's why I fell in love with red light, why I fell in love with photobiomodulation, because it dramatically helps accelerate patients' healing ability,
Oh,
even
absolutely.
in lieu of stellar home care. People
Oh,
were
yeah.
still healing even though they did not improve their home care. And the ability to communicate that healing, the ability to see that healing and show and educate that patient, that is how you build a business.
Well,
And so
I was a perio hygienist for 14 years without, before lasers came along. So I worked in perio and I saw what scaling root planning and it just didn't, you just lost ground. You just were losing ground all the time. And then when I became a laser hygienist after 30 years of being a hygienist, I saw how I could help my patients improve their oral health. It was amazing. I was hooked on being, using the laser on everybody. And
Yes.
I was lucky enough to have somebody who had two. I had this old strip and cleave BioLaser lasers, and he bought me two BioLaser Epics. And so I was very fortunate in that area to get into lasers at that point because it reignited my passion for dentistry.
Yes. S- So grateful. So grateful I met you,
Thank you
Jennifer.
guys for coming tonight.
Thanks, everybody. We'll be on for just a couple more minutes. That way, if you guys have any more questions that pop in, or if you have any other CEs that you guys would love to see, Jennifer and I are going to be teaching again in part 3. Please
Yep.
look out for your Zoom thank you. You'll get a link to register for that. Please follow us on all the socials. Um, and thank you so much if you've been in our laser class already and you're joining us again. Can't wait to see you again.
And if you
And can
aren't
you
laser
repeat how we get the
certified,
CE certificate? Oh, go ahead, Jen.
if you aren't laser certified, we're offering a course in Tucson on August 22nd.
Hmm.
And then you can go on dental laser integrations and see when all the other courses are in Phoenix or in Tucson and or wherever.
So
You're all
that's
over the place. So
dentallaserintegrations.com. Okay. And so just reminding you guys, the CE for this class is going to go out in the automatic email that comes from Zoom. So it's going to be a thank you email that comes directly from your Zoom. You download that PDF, you put your information in it, and you just save it for your records. Okay. So please make sure you look out for that Zoom thank you email, which is the same automated email that came to you when you clicked on tonight's webinar. Okay. And of course, you can always email me at info@dentallaserintegrations.com if you get lost or if you do not receive that. Okay, so we actually have a perio hygienist coming on in the next couple of weeks. I met her at Oral Systemic Mastery through Dr. Tom Larkin's Oral Systemic Mastery event. She was an attendee, I was a speaker, and she works with endoscopes, she works with laser, she's doing it all. So, not all perio practices are created equal, but when they have the trifecta of an amazing clinician and technology and the ability to create those patient relationships in education, it's beautiful. So we'll be hearing from her soon. And then our next class is going to be much more tactical. And then we will have a workshop available at the far end of this for anybody who's ready and willing to learn, actually go a little deeper and start to use your laser more frequently. Okay. So thank you guys. So happy. Thank you. Thank you. And thank you again, Jen. I'm so
oh,
grateful
you're
for you to
welcome. Thank
share
you
your
so much.
wisdom.
My pearls of wisdom, as you call them.
Yes.
You're welcome. And thank you everyone for coming tonight.
Good night, everybody. I'm going to
Night.
go ahead and end this.